Hi, I'm Andy Wible, and welcome to Timely Topics. Today we're going to be talking about advanced care planning, and our guest today is Luke Reynolds. He is the Executive Director of LifeCircles, PACE, and thanks for being with us, Luke.
My pleasure. Thanks for having me.
All right, well, why don't you tell us a little bit about what LifeCircles PACE is and your work there, how you got involved with it, and then we'll get into the advanced care planning area.
All right. Well, LifeCircles PACE is a wonderful program that's right here in Muskegon. PACE stands for Program of All-Inclusive Care for the Elderly. And the program is designed to help older adults who qualify for long-term care in a nursing home remain in their own home. And the way we do that is through a full interdisciplinary team of healthcare and social service professionals that have experience working with a geriatric population. And that team basically provides either directly or through contracts with other community organizations or healthcare organizations all of the services that an older adult would need to remain functional, healthy, and have a high quality of life. Okay. And that team includes, physicians and nurses, but it also includes physical and occupational therapists and social workers, dietitians, home care coordinators. There's a spiritual care component, pharmacy component, as well as direct personal care, transportation. Mm-hmm. We have a wonderful day center where people can come during the day. And while they're at the center, they have access to their physician for primary care. They also have access to those other disciplines that I just talked about. Wow. And basically, it's a national model. It's a permanently recognized provider type under Medicare. And it's an interesting funding because it blends Medicaid and Medicare services into one program instead of kind of siloing out those different kinds of care like a lot of the traditional healthcare does.
Okay. And first, how about you're located where?
We are on Seminole Road, right here in Norton Shores.
Okay.
And then we have a second site that just opened in February of 2016 in Holland, north of Holland, right in off of 31 in James Street.
It's the old D&W up here, right?
It is.
Yeah,
it is.
It's been totally redone, so you wouldn't recognize
Yep. It's in a building called Tanglewood Park.
Yeah.
And Tanglewood Park is the home of not only LifeCircles, but of Age Well Services and Senior Resources West Michigan. So it's kind of a one-stop shop for information or for services. If you're an older adult or looking for information for an older adult, you can come in and usually get directed appropriately.
Okay, so if you don't know whether you qualify or not, it would be to come by and see, or if you have a parent or a friend?
Yep, come by and see, or you can go to our website or call us directly.
Okay.
Yep.
All right, great. So what role does advanced care planning, you are part of a group called Chartered. Maybe you want to say what Chartered is, but then how did you get involved with advanced care planning?
Well, it's interesting. So I got my start as a clinical social worker with the VA system in Detroit. Okay. And so I was introduced at a fairly young age to older adults that have chronic health conditions. And I started to recognize early on that when family members or significant others don't have a clear understanding of what you would like to have done or not done in the event you're not able to communicate for yourself, it causes a lot of stress. So a family member may have a very strong opinion about what they think you want, and another family member may have a differing opinion. Mm-hmm. And without a clear, spelled out plan, or without having had those conversations with those people in advance, it causes a lot of moral distress. Oh, yeah. And it also causes confusion for the physician or the healthcare provider to try to figure out who they should listen to or what they should do. Fortunately, most of us are able to communicate our needs, and that works out well. But there's times, regardless of how old you are, that you may be put in a position where you're unable to communicate, and like I said, then your family member or your loved one is trying to have to figure that out. Right. So fast forward all these years, now I'm the head of this wonderful program called LifeCircles, and because we deal with older adults who are pretty frail, many of them have a lot of complicated health conditions, many of them have Alzheimer's disease. It's just really an important thing for all adults to do, is to have those conversations in advance with their loved ones. So that's kind of how I took an interest. Charted Healthcare Planning Coalition is a formal coalition right here in Muskegon that's through part of the health project, community health project, and it's made up of different community members and different organizations: Mercy Health, Harbor Hospice, LifeCircles, Senior Resources, North Ottawa Community Hospital, just to name a few. And our whole goal is to help, one, spread awareness about what advanced care planning is; two, provide people with access to certified facilitators, and I can talk about that in a few minutes; three, to make sure that if people do have a plan, that it's retrievable and followed. So it's really just getting the word out. It's really trying to get our hands around how many people actually have plans, and if they don't, why, and how to help educate not only actual people that need to have the plans, but physicians and healthcare providers. Our health system's been a little slow to catch on to the importance of this. Right. And I think because we have so many older adults now, with the baby boomers reaching old age, it's just become more of a urgency.
And we're able to, with modern medicine, keep people alive that maybe longer, and so we have a whole range of things coming together. Yeah.
Correct.
That need this. So let's start with what is advanced care planning? What are each of the elements involved in doing this?
Okay. Advanced care planning is kind of a generic term that basically says, what do you want to happen if and when you are unable to communicate your needs directly? And that it's usually two. Starting with the conversation, which is the most important thing, and which unfortunately in our culture usually gets glossed over because we don't like to think about death.
Right.
So it has to start with a conversation. Ideally, that conversation would be with the person who you've named or who you'd like to be your advocate.
Okay, so one is who's going to be your advocate, making decisions for you, taking your ideas into account.
Yeah. And that's usually, there's a few different terms we have for that. Sometimes we call that person the durable power of attorney for healthcare, or a medical power of attorney, a surrogate decision maker, or a healthcare proxy. All of those words are basically synonymous with, this is who I want to make decisions for me if and when I'm unable to.
Good. Okay.
Then the second document is sometimes referred to as a living will, an advance directive, and that's basically where you kind of spell out when or when not, or what you would like or what you would not like with medical interventions. And it could be scenario based. You know, if this is happening to me, this is what I would like to have done or not done.
So I don't want to be put on a respirator, or I don't.
Yeah.
Or if I'm in a persistent vegetative state, don't keep me alive, things like that.
Correct.
Okay.
Some of the big things that need to be worked through, things like feeding tubes, respirators, resuscitation. And again, as you get older, your priorities and your preferences may change based on where you're at in your life, what other health conditions you're having.
So if I make an advance directive today, 10 years from now, I can always revise it, right?
Yeah. Okay. And in fact, you should probably, once you have one done, revisit it annually, just to make sure it's still all relevant. Or obviously, if you have any significant health condition change. Yeah.
Right. And so, do I need a lawyer for this? I mean, is this something? Someone might think, oh, this sounds expensive. I'd have to spend a couple hours with a lawyer, get documents written up. Is that how we do it?
That's a very common myth.
Yeah.
Because when you hear the word will or living will, you automatically assume a will which lawyers help you with when you're trying to hand out assets or leave things for your loved one. A living will is much different. It doesn't require an attorney. It does require a conversation, and it does require a form to be signed and usually witnessed. But those forms are free. They're available online, or they're available, like here in Muskegon, we have forms at Tanglewood Park, or any of those coalition members that I discussed have actual forms that you can complete.
Often would your physician have them if you wanted to ask? Or?
Yes. Yep, that's another way to do that. And once you have the form completed, it's really important that you make sure your physician has a copy of the form. The person that you've designated as your power of attorney has a form, and hopefully even the hospital. If you use Mercy Health here in Muskegon, they should be able to keep that for you in your record.
And so you talked about that identifying who you'd want, scenarios. There's probably also like kind of what values you have. I know my grandmother, for example, she just never wanted to be a burden. And they're like, well, you need heart surgery. She goes, nah, I'm 86. I'm not doing heart surgery because people have to take care of me. I don't want to do that. No thanks.
Yeah.
Are some of those things part of that discussion about so your overall values?
Yeah, so one of the reasons the coalition is now named Charted Healthcare Planning Coalition, it used to be called the Muskegon End of Life Coalition. All of us agreed that although end of life is an important part of advanced care planning, it's not the main emphasis. The main emphasis is how you want to live. What are your values? What gives you purpose and meaning? What matters most to you?
Right.
So the advanced care planning process, if you have those conversations, we have trained facilitators actually available in our community, where they have been specifically trained to facilitate advanced care planning conversations. If you have the conversation with this certified facilitator, they will help draw out some of those things. Okay. Especially because, like I said, we're not used to talking about this in America. And so it's the guided facilitation will usually help bring your priorities to the surface so that you can then clearly document them and share them with your
So while these documents are available online, it's probably not best just to go in one afternoon and fill it out in 20 minutes.
I don't think so. I think that advanced care planning is a process. It usually involves multiple conversations. And like I said, when I've seen advanced care planning work the best, it's when the person who's been designated as the decision maker has directly heard from that person's mouth what their most important priorities are.
Yeah, I was on the Hackley Ethics Board for a while, and before the merger, and it seemed like most of the cases were family members disagreeing over what to do about mom or some loved one, and if that conversation would have happened earlier, boy, you wouldn't have needed the ethics committee most of the time, it seems to me.
Yeah. It's truly a gift that you give to your family.
Yeah, to take that stress off, because now I know what that person wants.
Exactly.
So if I go to one of these facilitators to work on an advanced care plan, who would I take with me? Or just can I go on my own, or would it?
You can go on your own, and usually I'm guessing that after one time with a facilitator, there might be another couple conversations that are planned, and maybe at one of the subsequent appointments you can bring your loved one or your person who you're designating, or maybe the conversation that you have with a certified facilitator will allow you to just have that conversation directly with the person. It just depends on how comfortable you are. And
so it might take an initial meeting and then to figure out what all you'd want to do and then go from there.
Yeah.
So where would I find such a facilitator?
Well, we have a nice process right here in Muskegon. We have a facilitator who is at Tanglewood Park once a month.
Okay.
And I don't have that date with me, but if anyone wants to call, oh, right here, staff is available at Tanglewood Park the second Thursday of every month.
Second Thursday.
10 a.m. to 12 p.m. to assist community members in developing a medical power of attorney. So you just need to call 231-733-8643, and you can schedule the appointment, and it's free.
Okay. Great.
I do have some stats that I thought were interesting.
Sure. Yeah.
So this is a 2014 of January edition of the American Journal of Preventive Medicine. They found that of the 7,900 respondents that responded to the survey, 26.3% had an advance directive. Lack of awareness is cited as the most common reason that a person doesn't have one. And then there's other barriers. So some of those barriers are cultural. We found some pretty stark differences between African Americans, Hispanic Americans, and white Americans. Denial, confusion, and then, like I said, overall lack of awareness. This is another really important fact. Most people say they would prefer to die at home, yet only about 1/3 of adults have an advance directive expressing their wishes for end-of-life care. It does increase for people 60 and older. That number rises to about half. So again, as you get older, I think you start thinking about these things and you're more likely. But really, when you're younger, it's really, really important, because when you're younger is when you could have an accident or something which catches everyone off guard, and then they're forced to try to make decisions.
Yeah. I mean, if we think about some famous cases like Terry Schiavo, she was very young, I think 20s when it happened.
Yeah.
And so, boy, wouldn't it have been better if her desires were clearly stated and could have been followed?
Yeah. So, and how much suffering could have been alleviated from not only her, but her family members too.
Sure. Wow. So if these at Tanglewood, would these be open to anyone, or is this on Thursdays, or is this mainly for your clients?
Nope, it's open to anybody, and it just happens to be located at that
okay,
building.
Great.
Yep. There's also a lot of resources online, and there's some, we're working on our website that's soon to be launched, our Chartered Healthcare Coalition, where you'll be able to actually download the forms. I think there'll be a mechanism for you to submit your information to someone to be contacted to schedule a guided facilitation.
Okay. And I guess it'll be nice with the more and more we get electronic medical records, that information will be available to providers to say, oh, here, I got the advance directive right here.
You're right, because here's another stat. Between 65 and 76% of all physicians whose patients had an advance directive, they were not aware that it existed.
Wow.
So we can do all this work at creating these wonderful plans and understanding a person's preferences and wishes, but if it's not retrievable and it's not followed, it doesn't do much good.
Right. Interesting. Now, are there some communities that are maybe above that 20-some% that we heard about? And do we know where Muskegon falls? I assume we're pretty average, but...
Yeah, I think we're pretty average. I don't think we've done any recent research on this, but I think it was about 10 to 15 years ago, we were right around the national benchmark, which was 25 to 28%.
Okay.
There is one place in America that has exceptional success with this whole idea of advanced care planning, and it's in La Crosse, Wisconsin. I'm quoting an article here that says, "You're unusual if you don't have a plan for your death." 96% of people who die in La Crosse have an advance directive or similar documentation, and nationally that's only about 30%.
Wow.
So they
96? Is that what
96%.
Wow.
That is a standard practice of care in that community, where it's not only not taboo to talk about, but it's very easy and encouraged and just a part of everyday life. and then that plan follows the person. So,
And I suppose that didn't just happen overnight.
No.
That they got to 96%. It's been a long process.
it's been a long process, and it was actually a man by the name of Bud Hams, who's a medical ethicist, who's pretty elderly now, but he's still involved. He's put off retirement because he's so passionate about this. And basically, he's similar to what you've talked about with your work on the ethics committee at Hackley. He saw so much moral distress from families who were suffering with trying to make decisions for their loved ones. So he just started many years ago working with nurses to help them start trying to have discussions with people. So they would start asking questions like, if you reach a point where treatments will not extend your life by a few months, or will extend your life by a few months, and side effects are pretty serious, would you want doctors to stop or continue to do all that can be done? A lot of patients said stop. So again, the way we ask questions, I think, will either invite conversation and help people think, or we could approach it kind of like a checkbox form completion. Do you want CPR, yes or no?
Right.
Without a context or without some of the discussion to help people understand what it means for them, we're losing an opportunity to really follow what they'd want.
Right. I'm even my own parents. I mean, I kind of work on this stuff. I teach biomedical ethics, and I'm like, Mom, Dad, do you have your advanced directive? Do you have your advanced care planning? And they're like, yeah, no. What is that again, Andy? And they had multiple surgeries, serious surgeries.
Yeah.
And it wasn't until my mother had open heart surgery not too long ago that she said, Andy, we finally filled out those forms. And to them, it was just forms, you know.
Yeah.
And it was given to them right before surgery, and they're like, I don't know. This seems like a lot to think about right before I'm heading into surgery. It's probably not the best time.
I agree.
To think about these things.
I agree.
So if we could have those discussions ahead of time,
Yeah.
boy, wouldn't that be nice?
I agree. And for people like me who run programs for older adults who are chronically, have many chronic health conditions, my vision and my dream would be that everyone who comes through our front door and enrolls with us has already had these conversations, and that we're not now having them for the first time when someone is already older. Many have already cognitive limitations.
Right.
And then the fear kicks in. Because when you're in the midst of it is when you're fearful.
Right.
If you pre-plan, you're in a different state to try to think through those things a little more rationally.
Yeah, wouldn't you think, I mean, conditions can change and your ideas might change,
Right.
but the clearer you can think about it, seems like the better to me.
I agree. I agree.
So if what do you see as the goal of I mean, how do you see some of the plans of Charter to get that word out? I know you're on the show today, but any
Yeah.
other plans that you see?
Well, one of the things that we really think is needed and is a priority that will take us to the next step is actually figuring out a way to fund a position where we can have even if it's part-time to start, advanced care planning coordinator.
Okay.
Because we are a very invested group of steering committee members, but we're also all very busy in our own work.
Yeah.
And so the little bit of progress we've been able to make has been because we've rolled up our sleeves and tried to get work done. So we really think that a dedicated person that's whole focus is, educating the community would help. How we have it structured now is there's 3 kind of subgroups that meet outside of the General Steering Committee. And those subgroups are community education, or community awareness and engagement, education, which is really focused on training people to be facilitators,
Okay.
and then making sure that if they're trained as a facilitator, that they have the ability to have conversations and people have access to them.
How many facilitators do we have right now in the area?
I think there's around 15 or so in our community.
Okay.
Mercy's making a more focused effort on trying to help get facilitators at various physician offices throughout their health system.
Okay.
And then the third group is really a physician work group, and I think you need to have physician champions behind this. There are some new Medicare rules that allows physicians to be paid for having some of these conversations, because I think one of the barriers when you're a primary care physician in a busy office and you're dealing with presenting problems,
Yeah.
it's
You've
not
got 15 minutes.
If
the
that.
patient just said they've got 20 things wrong with them. Now you want to add this?
Exactly.
Tough.
Exactly.
Yeah.
So I think the federal government is recognizing that we need to do a better job. And I think that, there's some more statistics. I think well over 70% of people, when you poll them, say they want to die in their own home.
Mm-hmm.
But there's still way too many people that are dying in hospitals.
Sure.
And there's way too many people that are having aggressive, invasive medical treatments that not only don't extend their life, but many times shorten it,
Mm-hmm.
and then lead to more suffering and
Sure.
less function.
Yeah. Now, this discussion with the physicians, some were worried that this was a death panel, that they'd kind of be saying, physicians would be encouraging people to take options that would limit the length of their life.
Yeah, I think that's the complete opposite of what the true intention is with advanced care planning. I think it's probably safe to assume that in America it's tough for us to talk about death.
Mm-hmm.
Physicians don't like
To do it either.
to do it either in
Yeah.
general. They see themselves as people that are trying to heal, cure, and extend life. And so I don't think people should be afraid to have those conversations. And I think physicians with practice and when they're asked by patients will start to become more comfortable and
Mhm.
accustomed to having these conversations. And there's no ulterior motive behind this movement to tell people not to get care they want. It's to
Mhm.
really understand and help them work through
Right.
and think about care.
So if you want everything possible done for you, that's great.
Spell it out.
Yeah, let us
Yep.
know. That way we'll treat you properly.
Exactly.
Right. Okay. Well, these are some good things here. If people, I know you gave the number for if you'd like to talk to someone on Thursdays.
Mhm.
You said upcoming website.
Yeah.
Where would someone find that?
Well, we have a couple websites. So one of the nice things about West Michigan is we are pretty collaborative, and there's a coalition in Grand Rapids that's called Making Choices Michigan. And Grand Rapids is a much bigger area with a lot more people,
Mm-hmm.
so it's obviously their steering committee is a lot bigger than ours here in Muskegon. But if you go to their website, it's called makingchoicesmichigan.org. You will get some information and some resources as well as some forms. Eventually, our website is probably going to be chartedhealthcarecoalition.com
Okay.
or .org, but I'm not sure what that link is yet. But if you go into the Community Health Project,
Right.
it will list us as one of the coalitions, and you can get some
We'll find it
information
through there.
Yeah.
Yeah. Okay.
Yep. And again, the number to Tanglewood is 733-8643. And then LifeCircles is www.lifecircles-pace.org.
Okay. Great. So lots of good resources.
Yep.
Thank you. Good luck, and thanks for all the work you do.
Thank you very much. It's a pleasure.
Thank you, everyone, for tuning in to Timely Topics. We've been talking to Luke Reynolds, who's the Executive Director at LifeCircles PACE, about advanced care planning and all of the good work he does at LifeCircles PACE. Until next time, have a great day.